Monitoring, evaluation, accountability and learning have been identified to be critical metrics of assessing the overall performance of organizations such as NGOs and governmental bodies. Additionally, it helps in evaluating whether a project is achieving its targets and understand the required needs and adjustments. As organizations aim at pursuing successful projects, the demand for its skills has gone up. This program by Humanitarian Global is an introductory course to the meal field that seeks to enlighten upcoming meal professionals on essential project management skills. Among the covered modules and topics include Introduction to Meal. The learner will get to learn more about the history of meal, what is meal phases, and the significance of meal. In the second module, which is Meal Planning Part 1, the participant will develop more skills on how to execute learning in meal, participatory meal and how to develop objectives and indicators. In Module 3, Meal Planning Part 2, the learner will gather advanced skills in Performance Management Plan, Indicator Performance Tracking Table, Data Flow Map and Summary Evaluation Table. Apply for this course today by visiting our website, www.humanitarianglobal.com for more details.
And before we begin the official session, we have two people I'd like to introduce. The first one being Anthony. Anthony, are you there with us?
Yes, I can hear you, Eric.
Yeah, Anthony, you can introduce yourself, tell us who you are. Also, maybe give a small introduction about Humanitarian Global, what you do, and why we are here today.
Okay, thank you so much, Eric, and to all of our participants for connecting today for our Zoom session. So my name is Anthony Mkuhi, the Academic Registrar at Humanitarian Global, and I hope well enough, and thank you so much for confirmation, Eric. So today we are going to be focusing on ethics in data collection, and I know the presenter for the day, she has been able to prepare, and we're going to have an interesting session. And thank you so much. But before then, I would like just to brief you on who we are as Humanitarian Global, what we do, and just to help me do that, I would like to share my screen, and I'll be done in a few so that we can get started with the session. So Eric, you can confirm whether you can see my screen.
Yes, I can see your screen.
Okay, thank you so much. So Humanitarian Global, we are an organization that is based in Nairobi, Kenya. Our main focus has been to work with both humanitarian and development professionals like you in capacity building, and that is what we excel in. And among besides doing the capacity building, I'd like to also take you through on other areas that we focus on. So training and learning, that is our core area of focus. That is ensuring that through our online courses, training programs, webinars like this one, training workshops, conferences, capacity development sessions, and also team building activities, we are able to work with you as an individual and or maybe as an organization in that regard. Secondly, we do work with a pool of experts, like the one who will be steering the session for the day. And based on our the pool of experts that we work with, we are able to work with you in the capacity of consultancy assignment. So that means in case you want to seek professional advice, you might be working on a certain project as an organization, as an individual, you can approach us, and then we're going to work with you also in that capacity. On top of that, we also ensure that through our platforms, we are able to share it with you so that you can use it to publicize your initiative that you're doing to better humanity. So that means if you're out there doing a humanitarian initiative, you can always approach us, and then we're going to partner with you so that we can also have your initiative on our platform for the global audience. On top of that, we also have humanitarian resources, and one of the key resources that we have is writing blogs for you. We do write blogs on very many topics, and through our website, you can always access them. On top of that, we have a discussion forum, and this is a forum that I know some of us, they might be part of it. And if you're not part of the forum, I would encourage you, go to the Humanitarian Global website, make sure that you can access the Humanitarian Global website. join the Humanitarian Global Community, that is the HG community. And once you go to the landing page, there's a link here for the HG community. So this is where you can be able to interact with other professionals like you from different parts of the world. That means we engage in very interesting conversations, and you can even see based on some of the recent topics that we were discussing, we were able to get very many participants, and most of us participating and also giving their input. So that means way beyond just interacting here in the webinar. We also have a platform where we can further our communication. So this is a platform that I would like to urge you be part of it, so that you may also link up with other professionals from different parts of the world. And we believe together there's a lot that we can learn from each other. So thank you so much. And one of the most frequently asked questions, that is, do you offer certificate for the training? The answer is no. So these are being a free webinar. We do not issue certification, any certificate document. However, what happens, you can follow up with us after the session, so that we can take you through now further training. And that means that through our programs, you can be able to be part of the team that does pursue further training in some of these areas and others, so that now after that you can be able to get your certificate and also get your digital badges and other documents. So we encourage you. This is just a brief session in terms of what we can, the depth that we can cover when it comes to the matter of the day. But after the session, feel free, and also during the session, talk to our team, and we are going to guide you on how you can be part of the other training programs in MEAL and also any other area that you might be interested in. And maybe just to also mention, we already have your details, and that includes your email address, because for you to log in for the session, you must have given out your details. You must have registered to our database for you to be allowed to join in. So with that said, there's no need for you to reshare the same contact details on the chat section. So let's just maintain the chat section for comments, feedback. And if you have any question, direct it to the Q&A section, so that we can be able to respond to inquiries there. So thank you so much, and back to you, Eric.
Thank you for that introduction, Anthony. Our next person is our key speaker for the day. Winnie, are you there with us?
I'm here, Eric.
Yeah, you can give a small introduction, then you can kick off the session.
Okay, thank you so much, Eric and Anthony. Good morning, everybody, or good afternoon, depending where you're joining from. Thank you for coming this session. My name is Winnie Moya. I am an M&E specialist. I have been working in the sector for over 8 years now, both in implementing in an NGO as well as a consultant, as I do today. Take you through some part of data collection. So we've had a few sessions on data collection, which you can also find on the Humanitarian Global YouTube page. But for today, we'll be going through ethics. Eric, maybe confirm if you can see my screen.
Yes, I can see your screen.
Okay, great. Great, okay, so we'll just begin. Today's agenda is mainly about ethics. So we'll go through generally what is ethics, and then key principles under ethics. So I've segmented them into 4 main ones, which are confidentiality and anonymity, consent and communication, child safeguarding and participation, and lastly, data sharing. So let's start with the definition of ethics, or what is this terminology called ethics. So ethics, these are principles really that encompass quite a few things. So this is a moral obligation of gathering, protecting, and using personal information, which affects the individuals which may affect the individuals who we are collecting the data from. So this is whether you're doing a monitoring assignment or an evaluation. So at any point that you're collecting any form of data, which can be an interview, a survey, a questionnaire, an observation in an area, any form of data collection. So these are the obligations that are guiding this personal information that you're receiving from the respondent, who can be a beneficiary of a project, or even an external partner who maybe you're just collecting information from regarding the project. So these principles, these ethical principles, are a guiding theme so that we make sure that we are protecting these respondents. So we are protecting the data that we've collected from them, and we're also making sure that the data collection process is voluntary for all, and also that they are informed about why we are collecting this data and how we are going to use it, because that is their right as respondents, as beneficiaries. Remember, there in MIL, there's the aspect of accountability. The A is for accountability, and they have the rights. They can hold us accountable to why we are collecting this data and what we are going to use it for. And we are actually supposed to give them back the feedback of how the findings that we have gotten and how we are going to use those findings, whether now or in the future, maybe a different program or a partner. It's important for them to be informed on this. And then lastly, and most important, is to make sure that this data is safe, and also that the process of data collection is safe for all participants. Remember, when we talk about participants, we're also talking about, all ages, all genders, all vulnerable people, marginalized people, may they be children or elderly, anyone who we can collect data from, depending on your project. So in short, ethics should be maintained when you're collecting, analyzing, and storing data. So that is at any step or process that you're using this data that you've collected, even after you've taken it from the field. Remember, this is information which has there's personal information in this data. So that means it is someone's opinion, it's someone's information that they have given you voluntarily, and in this case they have trusted you with this information. So we need to be ethical when we are handling this data. So again, I think as a guideline, it's important to remember this do no harm principle, which most of you may be aware of, especially if you're working for a non-governmental organization. It's a widely recognized principle of customary international law. And what it really encapsulates is that it's about security, safety, integrity, and the well-being of participants of data collection. And so in these participants, we have enumerators who may be staff of the NGO or external enumerators. So these are people who you've trained from the community, or you can have partners, both internal and external. So other organizations, they could be NGOs or civil CBOs, so civil-based organizations, or even like governmental partners, any type of partners, and researchers. So it's important that we maintain these principles of security, safety, integrity, and well-being to all this, and including researchers as well. So again, to emphasize, we are talking about human rights, even in this ethics. At the end of the day, all these principles are adhering to human rights of basic human rights of individuals. These are the respondents whom we are interacting with, and even the people who are collecting this data. Again, we need to maintain high integrity. So basic human rights of all individuals we need to respect and protect these rights, especially now when collecting this primary data and conducting any type of fieldwork. So even when in the preliminary phase of fieldwork, where you need to ask for authorization, or you need to, when you're getting into a community, for example, and you need to talk to an elder before now you arrange for example, a focus group discussion, it's important even at that point, before you start your data collection, that you treat everyone who you come across with respect. That's a basic human right. And remember, there's a ripple effect of this. You are a representative of your organization, or even when you're a third party monitor or even a consultant, remember you're still a representative of the organization, because you're coming to collect data for a certain purpose, for a certain organization. And this will also impact the way that the feedback is given to you, because once you're friendly and you honor the elder, for example, now when you're starting your data collection process, he or she may be able to help you and assist you and even give you some more information that they would have gotten if, for example, you came with an abrasive manner. So in a way that maybe you're not holding high integrity. So when we engage in this do no harm, we need to minimize or completely avoid and eradicate different types of harm. So there's mostly physical, social, and psychological harm. We'll just go through this in a minute, but again, just to emphasize, you have to be ethical to maintain integrity. As I've mentioned before, this is for your own good, for you to be able to go through this data collection process smoothly. So the types of harm, so we can start with physiological harm. So this is when you're asking sensitive questions, which may trigger a person, the respondent that is. So they may feel some sort of shame or anxiety, and they may not be comfortable enough to give you the responses. So for example, if you're having a gender-based violence project or program, and you can, when you're asking some questions, it's important for you to, there's a chronological way of asking questions. You do not start with very sensitive questions at the beginning, and you have to build a rapport. Remember, as we've said, these are humans, so you have to maintain some integrities. You have to make sure that you have a good relationship with the person, and you can always tell with the body language when someone is comfortable enough to give you the information. So even in the setting that you're asking these questions, you need to make sure that you're not like completely isolated, especially if it's now those kind of projects like the GBV. So you need to make sure that the person is in an environment that they feel safe. And remember, we mentioned safety as one of the core principles here in the do no harm. Okay, so another type of harm is social harm, where we talk about like participation of people in like social risks or public embarrassment and stigma. In public embarrassment, I can give an example. So for example, if you have a health project and you're interviewing people you have a household questionnaire, and you're asking questions on the prevalence of HIV, for example, and you go to a household and you maybe standing at the door or outside, and you're interviewing the person who may be at the door inside the house. And so for that reason, your voice is not very low so that the person can hear. And when you ask questions like, how many people in your household have HIV, or did you go for your ARV treatment? And maybe the neighbors are there or they cannot hear and the distance is very short. The person may feel ashamed or feel like they can be stigmatized if the neighbors or anyone who is passing around will hear their response to this question. So again, as I mentioned, there's a way that you need to ask these questions. You need to make sure that the person also understands from the beginning. You need to be very explicit that you're coming to ask questions to do with a program. You don't have to say on HIV, but you can say a program that has been being conducted in this area for the last 2-3 years by this and this organization. And then from there, you talk about maybe potential findings, the reason why you're collecting this information. So if it's for an evaluation, maybe you plan to support the people who are being impacted negatively by certain illnesses. So the person now is now understanding, okay, so we are talking about diseases, and there will be a chance that you may ask about some illness. So that is also psychologically preparing the person. And so they can either tell you, they can give you some time then, or tell you, okay, because there's someone in my house, or there's a lot of activity with the neighbors, and they feel like they cannot maybe give the information because it's sensitive, and they will be embarrassed. They can give you another time slot to come and interview them, or another place where you can meet, and then they will be more open. So it's all about planning well, and about also giving the information about the data collection. Okay, so we can move on to the third one, which is physical harm. So physical harm is about pain or injury which can result from study procedures. So this is not very common, but there are times when maybe trainings can be physical. The project had like some physical training, maybe on some support of, for example, maybe it was a youth training where you have like some programs which were sport-based programs, and there could be instances where maybe you're doing a monitoring and you need the person to do some sort of demonstration, which may cause some injury of some sort. Most of the times it's not that you want the person to be injured, but an injury can come out as a result, because remember, you're not, most of the time you're not an expert of the field that you are monitoring in. So if it's, for example, a sporting training that they did, most of the time you're not a sports specialist. So unless you are, like, you cannot gauge, maybe this person has like the ankle has gotten twisted, so what to do, or what potential harm there is, which can be accelerated by you asking them to do a demonstration. So it's important to maybe avoid this if need be. If it's a must that a demonstration has to happen, maybe you can do a monitoring visit when they're actually undertaking the exercise, the physical exercise that you need to record that is being done. So apart from that, then any other physical pain should not be pursued during the data collection process. Then fourthly, we have legal harm. So these are times when we have some sensitive information which leads to legal risks or breaches of privacy. So a good example of this is when we take photos when we are in the field and we haven't gotten informed consent, and we have not been explicit in the usage of that photo. So an example that I can give is, actually there was an organization that took a photo of a child, and just a child in a community. There was nothing really happening with the child. She was just playing, and this photo was used, of course, in the report. But then later on, it ended up being used in some signages, and how you can put it on like books. And so this later on, like much later on, the mother of the child went back to the organization and said, this is my child, and I didn't know that these photos were going to be used for this. And it became a court case. And I'm not sure if she was compensated, but you see, this is like it's a very big risk for you to use this personal information. This is private, and given that probably there was some consent to take the photo, but the usage of the photo was supposed to be only for the project. So you need to be very explicit when even you're informing these people of the reasons why you're taking the photos. And so it becomes very sensitive, and it can land in also the wrong hands. Remember, even if it's not a photo, for example, if maybe you lost some questionnaires which you handwritten, they can fall into the wrong hands, and someone can actually find that information, and they can contact a beneficiary, and there can be issues of fraud or stealing, like, of money. For example, when you have like cash and voucher assistant projects, it's a assistance project, you have to make sure that the information, for example, if you're using a mobile phone to transmit the money, you need to make sure that the information that you receive is kept very well, and it's only very limited people with access to that information. Because once there are issues of sometimes this money being, diverted. So there are issues, there are times when, you could find that an agent can come in between and they can say, no, give me this information, and then they get the money and transfer less money to the beneficiary without the beneficiary's knowledge. But then if, this is, again, becomes a very high risk if the organization is known to have, if that instance is actually found out in the organization or even by the donors, because remember, you're accountable to a lot of people in this regard. Okay, so I hope that's clear. So the last type of harm is child abuse. As we said, the participants or the respondents can be children. So we need to make sure that there's no abuse that is, no child abuse that is conducted by the enumerator or anyone who is collecting this data. So there are various forms of child abuse. There's the sexual abuse, physical abuse, which is like beating, emotional abuse, that is torturing children, exploitation, so to do with warfare, and even neglect. So neglect can be in the instance of, you may be interviewing a child and the child is crying and you continue asking the questions. That's not it's not a good thing. And you're not actually being present to the emotions that are being exerted by that child. So you need to, make sure as much as this is a child, that they're also in the right capacity to answer the questions, or even if it's an activity that they're doing, you need to be responsive. And even in this case, there needs to be also a caregiver present, or a parent or a teacher, or depending on the setup. And also you need to inform them of what is happening with this child as you're continuing to, ask the questions. Okay, so to summarize now about the harm, it's best to always consider the different possible sources of harm before you conduct your study, so that you have mitigating measures. Usually we have like a risk matrix, which I won't go through now, but usually that's done before you have your data collection, especially when you're doing an evaluation. So there are many risks that may be there that you can foresee, especially in very sensitive projects, which lead to the ones which I gave like an example, which can trigger negative emotions, so like the GBV. So there are high risks that sometimes the respondent may not give you the information, or there may be a lot of stigma in the society. So it's important to remember also some cultural norms that are there regarding some topics or some areas of discussions. So be cognizant of that, make sure everything is written down and you discuss them with your team. And even when you're doing your training of enumerators or the field monitors, as you may call them, it's important for them to understand that they need to have a positive effect, not inflict any potential harm, and go through the potential sources of harm so that they also are aware, because remember, different people come from different contexts and they may see something as normal and yet it's actually a source of harm. So it could be how just their society is, but in the context of data collection and ethics, that could be an issue. So especially where it comes to even child abuse, there's a lot of things which people deem as a gray area, because they may say that this is just part of raising a child, or this is normal, or you can just ignore the child. And yet we need to be cognizant and treat them as participants, and they have their own rights as well. So we'll actually go through child safeguarding and child protection later on, so I can talk more about that. Okay, I think we can move on now to one of the aspects of ethics, which is consent and communication. So here we are talking about informed consent. Informed consent is informed come from information. So you're communicating this information to all the participants, and then they need to understand it so that you can now call that informed consent. So consent is when they agree to undertake the study or the data collection. So they accept to be respondents. So they have to understand the purpose of the study or the data collection, any benefits that are there that they have. Don't think about just monetary benefits. Sometimes benefits could be that they are beneficiaries of certain things in the project. So there could be some non-food items such as buckets or diapers or soap that they have already received. So they need to understand that that's why maybe they have been selected as part of the sample of the project. Then they need to understand any risks that they may be there. So for example, if they are going to participate in this study, it means that they're going to give us their information, and a risk doesn't have to be a negative risk. So the risk is that we may contact them again and they may be also chosen for something else. So it's for them to understand also they're going to give out their information, their personal information, and it's going to be with us. It's already like something private, and so they need to understand that they're giving us some opportunity to find out more about them, their personal life. And then it's good to also disclose the funding of the study, because it's something that maybe you could be referring to, especially during evaluations. Maybe during monitoring, it may not be very important, but it's just important to mention it. And then just for them to, because they're in the community, they can see some signages, they can see if they are literate, they can be able to read and they can understand and grasp that, okay, so this X donor is the ones who are funding this project. So you are from that donor, and this project is supposed to have given me this and this. So it's for them to also understand also their rights and what was being done in the project. Then after that, they can decide whether they want to agree or decline to give the information. And remember, you cannot continue if they decide not to give you the consent, the informed consent. You end your data collection there as much as you've not started. You may ask if you feel that it's okay, given the body language, or if the person is open, you can ask why they are not willing to give you the information. Maybe it's something to do with the community. Maybe they have been already been asked so many questions, and there's that hesitancy. And in the previous session, we talked about how to mitigate this and how to be able to have a rapport. So in some cases, you can be able to build some trust, and the person can actually decide to give you the information, but it's really not up to you to press someone on to start, to give you consent to start asking the questions. So once they refuse, you can move on to a different another sample, and you can just note down that this individual did not accept to be interviewed. So when working with children, it's important to get the consent from their legal caregivers. So this can be parent, a mother or a father, or sometimes even an older sibling is actually their caregiver. And then in case where you're in a different environment, so if they're in school, it's important to inform ahead the teacher that you're planning to do this study, and you're going to ask the children a few questions. And so they also need to give you the consent. At the same time, they should actually inform also the parents that this organization is going to come in and they're going to be asking questions to the children. Because remember, children are very innocent. When they go back home, they will say to their parents that, oh, this organization came and we were being asked about this and this, and this is what I told them. And remember when we talked about legal harm, the parent may come to the school and say, I did not consent to my child being asked for questions, regardless of whether they were innocent questions or just 2 questions. The consent has to be it has to be informed, first of all, and it has to be from the caregivers. So it's very important, and it's very delicate when it comes to children. Yeah, so again, now, as I've said, this participation is voluntary, and it should be free from external pressure. The person is supposed to be willing to participate, because once they're not willing to participate and you've forced them to accept to participate, their feedback is also a little bit not authentic, let me say. So they may feel that now they have this pressure to answer these questions. So they may decide to give you some wrong information, or just, they may not be actually even give you all the information that you need. So they may even cut you off by the end. You might not reach the end of the questionnaire or the interview. So that's why it's important to make sure that it's voluntary and they feel very relaxed and there's no external pressure. So you only give them the information beforehand, and they can decide for themselves whether they want to accept or even continue or even withdraw at any point. They may actually accept to start the interview process or the the survey, and then at some point they may wish to withdraw. It may not be because of the person who is asking the questions. Maybe something urgent has come up, maybe their child is crying, maybe an emergency, they've been called. So those are some things which you need to be cognizant of. But at the end of the day, if you've had informed consent, they need to also understand that you're still going to use the information, despite maybe you not completing it, especially where you may have like a small sample and you don't have a lot of time to increase the sample and ask more people questions. So you just accept the person withdrawing at any point, and then they may feel free to, if they feel that they still, again, maybe at the end don't want their information to be used. Remember, this is also their right. They can say, I've given you this information, but do not use it. And so you have to disregard the information and report this to your manager. So whether it's a third party monitor, maybe someone who you've just trained from the community, they need to report this to the project officer or the M&E officer. And then from there, because if you're collecting the information on Kobo, remember it's already probably gone to the server. So you need to make sure that information is discarded and that it doesn't fall into the hands of anyone, because the information has not been consented to be used. So again, just to emphasize, it's important to make it clear to participants that there's no negative consequences if they refuse to participate or if they withdraw. And you need to make sure that you're respecting their decision and that changing their minds is okay. You don't tell them that you can change your mind, but you can tell them that it's your right to withdraw at any point or to stop the interview. Sometimes you can actually stop the interview and continue after, maybe they can give you like an hour, maybe they just need to maybe feed their baby or, attend to something really quickly and then come back to you. So you can discuss and come to an agreement about it. But as long as the information has been communicated, the consent has been informed and they've understood completely why we need this information, then that informs their decision either to stop or continue. Okay, so lastly, again, on consent and communication, we need to make sure that there's no pressure, especially when we're talking to vulnerable groups. These are marginalized groups. So for example, refugees or people who have, really undergone some negative circumstances of life. We need to make sure that we are also very sensitive with them. When you're communicating with them, there's a manner that you speak to them for them to understand. If possible, you always get someone who is part of them, part of the community, who can actually now bring in the rapport for them to understand why you're undertaking now this study. Maybe they may be more, they may understand a local one of their people better than an external person, or they may be even more open to one of their own than an external partner. So again, the same thing still applies. You still need to give them the information. It's just about how you do it. And then again, lastly, we are talking about how we obtain consent. Mainly it's through signed written agreements, so whereby they can write their initials, or we can use in groups, especially these vulnerable and marginalized groups, usually we can do a fingerprint. So you just have some ink, which can be even just from a pen, and then you place it on the paper or the sheet, or you can, if you're having a physical form, or if not, you just get their initials once they consent. And then you can also have verbal agreements, whereby if they consent to, again, being recorded on audio, you can have this also on audio. Just when they consent, you can start the audio and ask the question again, like, do you consent to us continuing? And then you have the audio saying, yes, we can start. So you can have the verbal agreement. If they don't consent to the audio, it's okay. There are times when they still consent, and you can just write it down that they consented, but they did not consent to have it taped on audio, as long as they have been informed, because you just don't want the negative repercussions of the person going back to their community and saying that this person has recorded me and I didn't consent to it, and I don't even understand why they were recording or what this information is about. That's all we are trying to eradicate by having informed consent. Yeah, so for the literate participants, you can read to them the text on the consent, so the consent form, and then you ask them if they have any questions, or they can even read for themselves, and then they can now sign. If they're able to sign, they can sign, or they can initial the consent form. So this is not sufficient, again, as we've said, about for the vulnerable people. They need to really understand everything, because they cannot read. So you need to explain to them very simply what you're doing, what the study is about, and why you're collecting the data, and what the potential findings, where they're going to be disseminated, and kind of the feedback loop, because remember, you're accountable to them as well. So always, again, translate these materials. If there's an issue of languages or language barrier, make sure that you use the locals to help you to translate this information into the local language. Yeah, and then for children, as we've mentioned, you need to make sure you have informed permission from their parents or guardians. Although children can still give you some informed consent, but you need to do both. But remember, once the parent and guardian have given you consent, remember we've talked about child abuse, whereby the child can be crying when you've already started the interview, but that is your cue to stop. So that means that also for them, they've not consented to continue or to actually even give you the feedback, as much as their parents or guardians have said yes. So it needs a little bit of you have to look at the situation and also weigh, is it really practical to continue asking a disturbed child questions? You need to make sure that the respondent is always comfortable. And about children, again, according to UNHCR, the child is anyone under 18 years. So it doesn't matter if the child is 17 years, that is a child at the end of the day. And you need to treat them as that, because if any harm is inflicted on them and it comes to, the organization, again, it becomes like a legal issue, she or he will be treated as a child, and you will be treated as an individual, an adult who was undertaking some abuse to a child. Okay, I hope that's clear. And I just wanted to show you this consent form as an example. I hope it's clear enough. It's just an example. It's not a one-size-fits-all, but it's one that I've used before. So the main things that you can see highlighted, or rather in bold, are the main issues that we've talked about. The participation is voluntary. and the person is free to withdraw either before, during, or after the interview. And then if they wish to decline, to not answer any question, they're free to decline, which is okay, and you can skip that question. That does not mean that you stop the questionnaire, the survey or the interview. What you do is just you skip, and you can maybe ask, why they don't want to answer. But if they seem disturbed, again, as I said, you have to look at the scenario as a human, from a human's perspective, and then you can move on to the next one. If they are completely distressed, again, it's up to you to also weigh the situation and see whether to stop completely or to tell them to, have a break, and then you can come back to it. Okay, and then again, all answers are confidential and they will remain anonymous. We'll go through anonymity and confidentiality next. And then we talk about the audio recording, which is now usually we do it for two main reasons. One, as an evidence of the interview, and two, for transcription purposes. So transcription is whereby we are writing down the actual responses. It could be word for word or summarized after the interview is done. Remember, when the interviewee is speaking, you may not be able to capture everything word for word. So when you record the audio, you can go back and listen to it. Maybe you missed a few things. And remember, especially when you're doing the interview alone as one person, it's hard to still be cognizant of time, look at the nonverbal cues, and at the same time, you're cognizant of this person's responses. If they're really continue, you need to look at all these different aspects. So you may miss some things which they have said, and you may just note down only a few things. So when you go back to the audio, you can be able to transcribe, so you can write down everything verbatim. And then, so it's important to also highlight that their names will not be linked to the research findings or identifiable. That's part again of confidentiality and anonymity, and that the results that they would not be identifiable. So their personal information will not be identifiable in the report that you generate. So in this case, this was for a midterm evaluation, but you can just change that to whatever context it is. And then now you have like some boxes where you ask now these questions like explicitly, because remember, you can read out this questionnaire and someone is not really paying attention or listening, but once you ask like each of them, now this is again now you're asking again and emphasizing also on what the information is going to be used for potentially. So they need to consent to all this, to agree to take part in the interview, and that it's going to be their opinions, and they can say that they can accept or decline to be contacted again for future purposes, maybe to verify some information. Okay, so you can just go through that. It will be shared with the slides. So we can move on to confidentiality and anonymity. So confidentiality means that you know the participants, who the participants are, but you're going to remove anything that identifies them from your report, because this report is going to be used or seen by both internal and external parties. So even if it's just for your organization, you need to protect these people. So you cannot be displaying their information, even if it's in your department. Remember, the consent was that it's between you two, the responder and the interviewer. So you need to make sure that you keep your side of the bargain. That means that you're protecting the information and you do not transmit it anywhere. Then anonymity, again, now means that you do not know who the participants are, and you cannot link any participant to their data. So that means that they're completely unknown to anyone, which is how it's supposed to be. So even when you have a report, you just generalize and say, there were these people from village X who most of them feel that this and this is what happened in the community. So even if you have maybe a quote which you want to insert, you just say a member of the community said this, and then you put your quote. So it's not, you should not put any names there or any other personal information. So this personal information includes the full names. This is the real names, identification names, the identification number. It could be through either an ID or a passport, their birth date, their location where they live, like, you know, the village could be general, but probably like their house number, if, or you know, something that really identifies their particular house. Email address also is personal information, or telephone number. So even when you collect this information and you store it somewhere with the data that you've collected, so it could be on the server or wherever for the hard copies, that doesn't mean that this information should be made public. It's only for purposes of that report, and it should not even appear there. It's only that it was collected to make sure that you've sampled the right people, you've gone to the right places, and you need to also just verify a few things. Then questions which you should be asking yourself on this information is how will this user's identifying information be protected throughout all the stages of the data science process. So this is mainly like, we've talked in the ethics, we talked about having ethics when you're collecting, when you're storing, and when you're analyzing, and when you're reporting the data. So you need to go through how you will protect this data. That's the confidentiality and anonymity. Then who at any point has access to this data. This needs to be controlled at all costs, whether you have like some data protection through maybe some passwords for some the sheets where you have all the information. And then you need to make sure like this password is only given to 2 people at most, or even just maybe the data analyst, that's it. And then now you need to question also, do you really need even this information to be in the data set? If you don't need it, you can remove it. But also this needs to be communicated very clearly to your manager. So from the person who is collecting the data, so you need to be together that you're going to remove this information, and from there on, you have a way of discarding this information, especially if you had hard copies also. Then an alternative that you can do is this data pseudonymization. So this is where you replace the information of the participants with like a fake name. And this is so that they cannot be linked to the actual participants of the study. And then it's, again, now you've already separated now the personal information from the data. So for example, for me, my real name is Winnie, but if I'm part of your study, I would not like my name to appear anywhere. You can call me Farida, and it doesn't have to be, it can be any kind of name, but it's usually where you see, even in newspapers, you can see sometimes they write an asterisk and they write not the real name, so that no one who is called now Farida, who has this sort of similar profile of what I've talked about, can be also linked to this. Okay, remember, because these are names which are also used in the community. So it's important to also write that this is not the person's real name, especially where you're using like case studies and you have to talk about maybe someone's journey. For example, if it's like a refugee who got help from a certain organization, so you can change their name and just say that this is not the real name. So that's called data pseudonymization. Yeah, okay, so that's all on confidentiality and anonymity, and we'll move on to child safeguarding. So when we're talking about child safeguarding, remember we said children is anyone under 18 years, and all children have a right to be heard, to influence, and to promote their own rights. They also have human rights because remember, they're human and their voices are very important. And specifically when you have projects where children are involved, whether directly or indirectly. So directly can be, for example, if it's an education project or a health project, depending on now the age groups. Indirectly can be when you're doing a health project, for example, for pregnant and lactating women. So, once the child is already born, for the lactating woman, like the child is also a beneficiary of your project. And so when it's, a child who is like about 2 years may not be able to really speak completely, but it's, there are ways that they can communicate. And it's important for you to record that or know how to use that, that action that they're doing as part of your feedback for the report. So you have to have the best interests of the children, or the child or the children as a group. The children's well-being and integrity overrides all interests of the project. So remember, when we're talking about a child who is distressed and you're asking them questions, that is not having the child's integrity at heart. So you need to make sure that you understand how to also talk to a child or interview a child. It's not the same way as you can interview an adult. So remember, children have, they don't really, especially the younger ones, they may not really sit still for even 15 minutes. They may just be distracted and they're running all over the place. So it's important to know how to address them and not be agitated. So you cannot be expressing yourself by shouting at the child or the children when you're collecting this information, because remember also, you're not alone when you're collecting this information. There's a guardian or a caregiver or a teacher, or even other children who are there. So what you're doing also is reflecting on other people, and they can choose not to, continue with the exercise, or even, assist you to even get other participants for your study. So children also have a right to participate, even when their parents have consented. I think I mentioned this a little bit earlier. So you have to understand and respect that right. And then you need to now make sure how, you need to know how to address that and respect that, and, explain to them that that is okay, and it's their right, and they can continue playing or doing whatever they were doing, and you can just move on. So remember now, as I've said, because of the different age groups between a newborn child up to an 18-year-old, those are all children. So depending on the age, they may have different ways to express themselves, whether they want to continue speaking to you or even accept in the first place. You need to understand this non-verbal cues mostly, because they speak a lot with their body, especially when they're not as expressive verbally. And when you understand that, you respect that, and you also, you can communicate with the parent or the guardian or whoever is there and tell them that it's okay. I think we can talk to, whoever the child's name is a little bit later, or maybe tomorrow. You can just give them some time. Maybe sometimes even they're just sick or tired, or just, maybe not in the mood to answer the questions, and that is okay. The point is not to stress them or to force them to participate. Okay, and then now let's talk about child participation as well, which is somehow interlinked with this data collection, whereby you have the children as part of the study or the this monitoring exercise. So as per any sort of participation, whether or not it's children, it should be actually informed, and it has to come voluntarily. So the children need to be willing to be involved in these activities, or in this the project that you are undertaking. So for example, you may have a project you're going to distribute footballs as like recreational kits for students or children who are between the ages of 7 and 15. And so you want them to, as they receive their kids, they also participate in playing football in their in their school or at their home or whatever recreation facility that is there. So if you find that some of the children are willing to participate and others are not, that is okay. Again, we are not going to, we should not force the children to participate. But then you also need to also read into this and understand what maybe are their true needs of these children who don't want to participate. Maybe there's something that there's a gap that is there that can be addressed by your organization. So it's more like also assessing and monitoring the effectiveness of the project that you've chosen or the activity that you've chosen. It could be about maybe the timing or different circumstances. So it's really now up to you to also now find out what is the motivating factors for this. Now, especially when you talk about now those marginalized communities or the vulnerable communities, which could be not integrated even into maybe the host communities. So they may feel that they're also not completely included, so they cannot come together and play. Or maybe it's about the age group or some gender issues. Remember, we talked about cultural norms, as we need to understand them before we start any data collection or any project event for that matter, because these are issues that the cultural issues can override certain aspects of the project. And so it's important to understand this even from a child's perspective. They may be feeling some pressure or something that they were told by their parents that they need to adhere to. Maybe it's a girl and they were told that girls don't play football. And so you need to find out this, and then now go back to the drawing board maybe and look at ways where you can now have maybe a girls only club, or how to integrate them together and make them understand that this is for the whole community and they're supposed to be together when they're doing all these activities. Yeah, so children's participation also is very important, because from there we can also learn from them, and it can help these programs to grow from ground level to even internationally. So when we talk about all the children have voices, when we understand them, we are able to also use that as a way to improve our ways of working, because for some of this project, and also we keep on saying that the youth are they're the leaders of tomorrow, and we have to empower them. So you have to make sure that also children understand that their participation is important, and it's going to have a bigger effect in future. So child participation also now helps them to build themselves up and increase their involvement in society, and it's a way of also just having society to also participate actively in also nurturing these children as they grow, because they can listen to them and understand how to support them, and even how to be there for them, and how to nurture children maybe better, or how to gear them towards maybe a bigger platform, or continue with whatever that drives them and supports them to grow. And so this again also impacts on the children's personal development and can lead to better decision making, as we've talked about. Maybe it can influence even policies at government level or even at international level, because once they're given the limelight, or their voices are heard, and they can be champions of different things, and they can be very powerful in decision making at all levels. Yeah, so lastly, let's talk about data sharing as part of ethics. So when we talk about data, this is the information that we've collected from the respondents, and we need to make sure that we protect everything that is confidential. We talked about the personal information as your full names, the person's full names, their IDs, their birth dates, anything that is sensitive that has been submitted to us. or it could be even records, personnel records. Remember, sometimes you're interviewing a personnel who's probably like a HR, and they may give you some documentation which is confidential, and we need to keep it as that. We need to make sure that this information is really handled in a secure and legal manner, because we already talked about the potential harms, especially legal matters that could arise from people finding out that the information has been used for the wrong, has been in the wrong hands, and has also been used for wrong or different reasons from what was actually discussed with them during the consent stage. So before collecting data, you need to make sure that you already have a plan in place on how to store this data. So whether it's electronic or hard copy, you need to know how you're going to store it or archive it, and how it's going to be shared. So remember, sometimes this information is collected on a Kobo or any other platform, and then it's shared to the person who's going to do the data analysis, which sometimes is not even someone in your organization. So it has to be sent somehow. It can be, now you have to decide if it's going to be through email or through the other modalities like WeTransfer, or you can use a flash drive. So you need to remember to understand like what are the risks of using these methods. And then again, also, how are you going to delete or destroy this information when the project is completed? Or are you going to still keep it even after the project is completed? And if so, how are you still going to store it again or archive it in a way that the only people who are actually going to access it are the people who need to refer to it, in that the project could be continuing or get a continuance later on, but maybe the project staff who was in charge has already left. So the person who now accesses it afresh needs to be able to, access it, but not share it again with the wrong people. And they need to continue, preserving this confidentiality of the personal information that is there, and only use the information that is relevant. So I hope that's clear, because it's very important that we have plans to do that before you collect the data, or even, you can have maybe in larger organizations, international organizations, there are already set rules about how this is done. So both storage and deletion and destroying of data. So there are very clear rules, and you need to adhere to this at all levels, and this needs to be communicated to all the staff. So be it like the M&E manager, the M&E officer, the field officer, or the project officer, everyone needs to adhere to this. And they need to understand why we are doing this is because of security and confidentiality of this information for the respondents, for them to continue also trusting us to support them in whatever way that the project is supporting them. So organizations are accountable for providing reasonable storage, and they have to have routines to ensure the quality and verifiability, or the reuse, sharing, and deletion of data, as I've just mentioned. And then lastly, on data sharing, we need to make sure that there are certain policies in place about non-disclosure. This especially applies when you have third parties who are going to collect the data, or who are going to analyze or use the data at any point. So we need to make sure that they understand that they need to keep this information private, and it's only for the purposes of the report, not for them to use for their own personal use. And in most cases, what happens is that the data belongs to the client. So that is the NGO, for example. And so once the third party collects the data and has finished reporting, if they're to do the reporting, the data is supposed to be sent back to the NGO. Then now you can decide on which platform, or actually even the data sometimes is even kept on the server of the NGO, and they only relay the information that is needed. So they can decide to remove those personal information that we've talked about, and they just issue the rest of the responses to the third-party monitor or the external evaluator. So those policies should be very clear and they should be signed by these parties. And even suppliers, for example, they need to also be cognizant of this. And to make sure that we have our confidentiality adhered to as one of the ethical principles. So only when, for example, when there are limitations by the donor, for example, to not share the findings. Otherwise, it's advisable that we also have like dissemination plans of the reports. But even when we are disseminating these reports, we need to make sure that there's no way that whatever information that we've given can be linked to a certain individual. Just because we've talked about issues of shame or embarrassment, and the person can also lose confidence in the organization. And this is really not part of our mandate as people who help the vulnerable and marginalized especially. So we have to present these many findings in a way that maintains the participant confidentiality. So an example of this is when you're having like a community who has a low literacy level, you can use community dissemination meeting. So whereby you can call the key stakeholders in the community. So people like the elder, and then you can have like representatives of youth, women, male, and if depending on the type of project. So maybe you can have also some groups of farmers if it's an agricultural based project. So just make sure you have some good representation. And then now when you're discussing these results, you just make sure that these community members already know everyone in their community. They know who was interviewed. Even if it was confidential, they usually just have a way of knowing. So even when you're communicating, just make sure you're not like pointing one area, talking about people from this area, say this, or any sort of desegregation, which can lead to people being linked to giving either positive or negative feedback, because this can have repercussions at the community level, even after you already have your dissemination meeting. But it's important to still share this information to them because it's part of accountability of you as a stakeholder. Okay, so I'll just touch on a few additional ethical measures. So for example, like for health researches, you have to go through some other authorization, which are like they have to check some certain ethical issues that have been kept and that have been planned in that research project. So for example, like in Kenya, I know it's the Institutional Research Board. It could be called something different in different countries, but it's a board that it's the governing board in each country or in each, sometimes different regions also in a country may have different legal measures. And now this approval is mandatory before you undertake particularly health researches. It could, the rest of the researches, sometimes if it's very intrusive also could be governed by this. So it just depends. You just need to know what applies there. So I can give you an example of a project that I did. It was on family planning, and it was a research in the northern part of Kenya, and we had to go through a really rigorous process of this approval. So in this approval, they tell you certain documents that you need to have in place. The data collection tools also need to be aligned to certain things. You need to ask the questions in certain ways. And then only after you receive the approval can you actually collect the data. And if you don't, you have a second chance to actually resubmit your documents, and they tell you the areas of corrections, and then you can resubmit within a certain time frame because they have to sit as a board and approve this. So that's again another ethical measure because they're protecting participants not to have any negative repercussion of your research. And then also ethically, we need to remember the selection of participants and respondents needs to be fair and just, because they're people, they're human, just as we are. And their selection needs not to be just because they were easily accessible or available to participate in the study, or maybe just because they are vulnerable, so you feel that they're less able to decline in participating. That should not be your reason for selecting a sample. There are certain ways that you do sampling. There are different ways of sampling. There's purposive sampling, random sampling. There's so many. So you need to make sure you've actually gone through sampling and you know the population, and you have selected those who fit a certain profile that the project is reaching. So this mainly applies, especially when you have like evaluations. For monitoring, you could just go directly to the beneficiaries of the project because you're seeking feedback. For example, if it's a post-distribution monitoring, you have to contact the people who have been selected by the project. But even when you're starting the project, now this mainly applies to like the project implementers, so the project officers or managers. You need to make sure that you're also selecting the right people for this project. So when we say vulnerable, that's a very wide and a blanket statement. What makes them vulnerable? Is it that they are widowers? Is it that they're in a certain age group? Is it that they are blind, they have some sort of disability? So we need to be very intentional and very specific in the selection of the population, because this is now the guiding factor, even when we're collecting additional data collection as the project continues. So I think the last point, I already mentioned it before, but just to emphasize that we need to always adhere to local customs, cultures, and norms when we are undertaking our monitoring and evaluation exercises. So when we're undertaking any sort of data collection. And remember, because we are now in the 21st century, things keep on changing also. Maybe things were not the same 10 years ago, and you could have been still in the same field. So it's important not to have assumptions, and to also understand and listen to the people, because you'll find, even especially like, for example, in terms of technology, you can find even like pastoralists. Some pastoralists have smartphones, and 10 years, even maybe 5 years ago, they didn't have. And so it's not an assumption to say that they don't have internet connectivity or access to information. It's only a matter of understanding what maybe controls how they access certain information, or if they understand how to even access this information, and how you can support them at the end of the day. But it's important to respect these customs and cultures when we are seeking for information from them. Yeah, and I think that's it from me. I think we can open up for questions. Thank you.
Thank you, Winnie, for taking us through the session. And if I may direct you to the Q&A, we have a few questions we can start with before we move to the second part of the questions still.
Okay, thanks. Thanks, Eric. So I can see an email, a question from Imelda Ifere. I hope I've said your answer, your name correctly. Your question is, what could be the best way to ensure that child rights has been protected? So if we're talking about during the data collection process, the onus is really on you as the data collection, as the person who is collecting the data, to ensure that you're upholding the children's rights. And so that means that, children are speaking freely and voluntarily, they're in their natural state. So, they need to be, normally most of the time, a child who is not under any pressure or in sight of any form of coercion usually is playful. So those are like some of the cues that you need to look at, that a child is not, too reserved, unless, maybe they're going through some illness or something. But again, it's not for you to start prodding why, you know, the child is maybe disturbed, or unless it's a child rights project, which again, there are also so many things which you need to take into account that you cannot start addressing at that point, because there are ways to report this. So there could be, for example, the parent or the caregiver is maybe not there. And so there are people in the community who most of the time have already been appointed to also support when it comes to this. So I can only speak to when now it comes to data collection. So just to make sure that you look at the nonverbal cues. And your second question was why in most African countries child rights are not being respected. Okay, that's like a very broad topic. I cannot really answer to that. There's so many researches still continuing, but at the same time, it's not good to generalize. I think it's just maybe some rights are not being respected, and it's again, communication, I would say, is really important. And we talked about certain cultures having maybe normalized some things which they not understand that that's part of child abuse, because child abuse is broad, as I mentioned. Okay, Tocqueville Dolo is asking, in the informed consent slide, you spoke about providing text for you interviewee to read. If the respondent is not illiterate, what should the enumerators or data collector do? I think your question is if the respondent is illiterate, what you should do. So if they cannot read the text, you're supposed to read it for them. Actually, even before offering the consent form for people to read, it's important for you to read it to them. And then after that, they can say, okay, can I have a look? Then they can read for themselves again. And you can ask them further if they understand. You can explain the issues maybe they may not understand. And then from there, you know, address the specific issues. If they are just not comfortable in some of the things, then you can know how to address that specifically. Okay. Then there's another question from Maman Sanda Abba. What is or are the best methods to collect child's consent? Yes, I think I mentioned this as we have to get the consent from the parent or the caregiver. So sometimes the caregiver is not the parent. It could be an instance where, for example, the parent has passed away or is just not present. Maybe there's a caregiver like an auntie or an uncle, or any other figure. So you need to get the consent from the person who's the caregiver, as well as in the environment that they're in. For example, if they're in school, you need to also get the consent from the teacher, because at that time, the teacher is the person who is responsible for the child, not the parent. But at the same time, we mentioned that the child, what they give is an assent, not a consent. It's agreeing to also participate. They have different ways of communicating. They can say it verbally or sometimes just their body language, but you will know, and you need to make sure they also agree to giving you the feedback before you start your data collection. Okay, and then Abraham Isaac is asking, as field monitor on behalf of the donor, couldn't I report the sensitive information that found in the site? Yes, okay, the sensitive information. I'm not sure exactly. I think if you can be a little bit more specific, but if you're asking if your questionnaire or your, whatever data collection tool that you're using is also touching on sensitive information, it depends. You have to find a way to ask it. I think my point on sensitive information was to make sure that you have there's a chronological way to ask the questions. First of all, you don't ask sensitive questions first. You have to go. It's like you're getting the rapport of the person, so you can ask them just general things before you get into any sensitive questions. It's okay to still report it, but you need to find a way to ask it in a way that the person will be comfortable enough to open up to you. I hope that's clear. Okay, then Kagiso Babili is asking how best can data be stored while ensuring privacy. Yeah, so there are many ways. There's no one size fits all. Remember, it also depends on even the volume of the data that you have, the type of data that you have. So it can be physical. You've had handwritten like notes, that is data. So storing that in, just on top of your desk, that's not storing. You have to make sure that it's in a safe where the combination is only with limited people. So the thing is about data storage, it's about knowing what are the guiding principles. It's about having limited people who have access to this data. And these people need to understand the data contains personal information. And so when using it in any form, whether analyzing or reporting, they need to make sure that confidentiality is upheld for the participants. I hope that's clear. Then Mohammed Kachala is asking, my question is regard to data sharing. Is it the funded organization that gives standard for sharing the data, or destruction of data? It depends. There's no like clear way, like maybe the NGO can have their own way of data sharing and data destruction, or sometimes you can have certain donors are very specific on these things. So you have to check each and every time. So it may not be applicable to whatever maybe policies that you have in place may not be applicable when you have certain donors who are giving you the funding. And again, even when you have these donors, it's also important to also let them know how you already do it, in case it's already a system that works and that you've not had any issue with it. Maybe they can be okay with it, but in some instances, they may want actually the data to be in their servers or for them to have it from the beginning. So it's just, it's not there's no standard way, like maybe each program could be different or each project different. Okay, and then Emmanuel Guela is asking, just wondering how we can obtain an informed consent when collecting data remotely. Yeah, thank you for this question. When you're collecting data remotely, which last week actually we were talking about remote data collection, so you can check also more information on the YouTube page about that. When you're collecting data remotely, there are many ways of doing it. One of the ways is to use enumerators who are in that community. So you're not actually getting people to travel, so the people who are already there. So when you use enumerators or field monitors, it's going to be just as we've talked about today. So they need to inform the person and they need to get the signed consent, and then they can move on. Secondly, another way you can collect data remotely is through these applications like Zoom or WhatsApp or Skype or Microsoft Teams, all these online platforms. So when we are conducting an interview like that or a survey, you need to read the same way that you would have done if you were face-to-face. You need to read or explain all the information of the project beforehand. And then the person tells you if they understand or they have any questions. Sometimes the person can also ask for you to share with them the consent form. And if they're literate, especially, you can send it to them, just the form. You don't have to send like the questionnaires. You can send that form, because at the bottom of the form, they can write their name and they can sign. So that can work, or you can at the same time also, if the person also agrees to audio recording, you can audio record, and you can have you can ask them again if they consent to for you to start with the data collection, and then you already now have the informed consent. I hope that's clear, Emmanuel. And then we have Rume William is asking about the difference between child safeguarding and protection. Yeah, so child safeguarding mostly, and and protection, like they overlap rather. And safeguarding is where you're like a third party. You're not the child. You're not interacting with the child at all times. That you're just making sure that this child who could be a participant, but not necessarily, but is in the environment where you're working in, does not undergo any sort of abuse or abuse, because now there are different types of abuse. But in child protection, we are talking about now making sure that this child who you're directly working with, or even living with, or could be even like your niece, your nephew, is protected from any harm, because you're in that environment. Like you happen to be in a position where you can protect this child. I hope it's a little bit like the overlap is not a very distinct difference, but it's only that in one, like you're very direct and closely linked to this child. But if you can look at Save the Children, have very clear definitions on this. Save the Children International, the NGO, they work a lot with children, and they have some clear definitions of this, so they can assist with that. And then let's move on to this. Thelma Lambda is asking, how do you handle the question? How do you handle the situation when the donors want to be anonymous to the beneficiaries of the project? Okay, yeah, that is okay. Then you don't mention the donors, but you can talk about the project and the kind of work that the project is doing, and just you can keep it at that. If, for example, if the person is actually inquisitive and they ask who is the donor, you can just actually explicitly just let them know that the donors actually want to be anonymized. Because remember, even this participant or this respondent also wants to be anonymized in your report. So for the most part, they will understand, unless there's something very specific or some information that is so specific that they need to understand about the donor. But in most cases, it's about the project. It's not necessarily about the donor. So that's okay. Then your other question is, how do you prove verbal consent from participants? Yeah, so one of the ways I mentioned is you can record. You can have an audio recording if they accept for you to start the data collection. You can put on if they accept the data collection and they accept also to be audio taped, you can start taping and then just re-ask the question on, do you accept for me to move on with these questions? And it should be clear to you if you have any questions that your personal information will be anonymized. Just summarize it, and then the person can say again they accept, and then you can start. Apart from that, it's okay when they don't accept any audio taping. It's only for you to note down that they accepted, and then you can just move on with the consent, and you can just note down that you did it verbally, especially when it's they're illiterate or they have low literacy levels. It's usually very commonplace, especially in these marginalized communities. Just make sure that you've given them the complete information on what you're undertaking the project and the data collection exercise. Okay. Then there's a question from Nicole Fortabong Masong is asking, could data collection through phone calls be reliable? Yes, sometimes in remote data collection, it could be one of the few ways that can work, or actually is the only way that can work sometimes, because when it's direct phone calls, maybe not through any WhatsApp platform or any platform like this. Yes, it's reliable, but you need to just make sure that you record, you note down whatever it is. If they decide not to have audio tape, you need to make sure that you have recorded or noted down in your own notes, or however you're recording. If you're typing it down, that that information that they relay. And yeah, of course, at the beginning, you have to give them the information for them to consent first, and then you continue. But yes, it's a reliable method. You just need to make sure also you have a clear connection with the person. Right, and then there's Rume William is asking, when do we break confidentiality when collecting and storing or sharing data? Okay, so we break confidentiality when we use this, when the person is able to, this personal information is actually traceable to the person. Remember when the definition of confidentiality was, you know who the participant is, but you have removed any identifying information from the report, or in this case, from where you're storing. So if you're actually able to identify this person, then you've broken your confidentiality. So the ways to go around it is now what we said, to use another name, for example, or you can remove this information if you do not need it actually. So in your storage, you can decide to hide the columns and lock them, and have also limited people to access this, the personal information specifically. Okay, Bayen Meka is asking, signing of consent form is most participants do not willing. Okay, what alternative should we use? So, okay, so I think you're asking, most participants are not willing to sign the consent form. What alternative can we use? So if they're not willing to sign and they consent, that is okay. So you need to find out also why they don't want to sign. Is it that they cannot sign? Sometimes it's the low literacy levels and they feel that they actually they don't have a signature, or they don't have, they cannot write their initials. You can ask them, can I put down your initials for you? You can use a fingerprint, which is sometimes used even when you're issuing like things like even food items, when you're checking that the person who has collected is that person, because they have to produce some sort of identification. So you can use a fingerprint, and you can also have the audio tape as a backup plan also, just in case. And you can just make sure that in the tape that you've asked them again if they consent to starting the data collection process, and then you can continue from there. Yeah, I hope that's helpful. Then Eli Akorsikuma is asking, you made mention that the selection process of respondents should be fair and just having in mind the population of the study. In many rural communities, it is difficult to know the population of farmers that will help you with accurate randomization. How do I go by it if I don't have the population? Okay, so this is, this cannot come up during the M&E stage. This comes up when you're already starting the project. So you may not have, in many places, not necessarily only rural places, we don't have the total number of population, but you already have, by virtue of your project already being approved by a donor, you have a target number, and this target number has come out of somewhere. Sometimes it's an estimate, but there are ways that they've gone about it. It could be maybe partner reports or some surveys which had been done before. There could be some secondary data that you can use as a guide of an estimate. So even if you don't have the actual, you already have like an estimate. But now when it comes to selection of the people for the data collection, if you want to use the random sampling and you already have let's give two scenarios. One scenario is that you already have the information of the farmers. You may not have all the farmers, but you have some names and some identification numbers. It could be the actual IDs or passports or any other cards that they have. And then from there, you can do a random selection using Microsoft Excel. There's a way that you can just select randomly the target that you have. For example, if you if you have a population of, let's say 1,000, and you collect about 300 out of that randomly. Now this is just by Excel, so using some certain formulas, you can have that. So the second scenario is when you don't have their numbers or their names, any identification, personal identification information. So there are many approaches that you can use. I don't want to go so in-depth into that, but one of the ways you can do is like, you can have a snowballing approach whereby you go to the field or this population that you've already selected, so these rural farmers, and then you can go, they already have the farms or wherever they're doing the farming, if it's at home or it's a farm where they lease, and then you can go to an area and collect the information from one person, and then they can refer you to another, and then you can go to another one, door to door, like that, depending on the number of people who you are even undertaking the exercise. But at the same time, you can be helped by some agricultural officers who are on the ground. They can help you to also have bring these people together. You can target whoever you want from there, or you can sample from different groups. So it's also about being innovative about your sampling. But I think my main point was that it needs to be fair. It cannot be just that you collect data from anyone who is easily accessible, because that again is already biased. There's some bias in that you've not profiled the person, because of course, remember, the project is not going to target everybody who can be accessed. They need some minimum criteria. We usually have like inclusion or exclusion criteria when we're doing, when we're selecting beneficiaries. So yeah, you need to just think about innovatively how to select the information, the people. Okay, I hope that's helpful. And then,
excuse me, Winnie?
Yes.
Maybe you can select the last 3 questions due to time. And for participants, we encourage you to join our forum, our community, where you may get to post the questions and we will still get to answer them.
Monitoring, evaluation, accountability and learning is an essential subset of project management. The subset has been identified and proven to be critical in the success of 99% of projects. Funding organizations are increasingly seeking more accountability for the funds they provide to development projects. Therefore, without an effective meal system, it would be hard to track progress, discover unplanned effects of programs, make judgments, or determine the impact an undertaken project will have on the target audience. Hence, undertaking this diploma course expertly developed by Humanitarian Global will help you develop advanced skills in this thematic area. These skills are essential in creating a roadmap for implementing project activities as intended. They also aid in conducting monitoring and evaluation activities efficiently and promptly, ensuring continuous learning throughout the project cycle. Among the covered modules and topics include: Module 1. Design logic models. In this first module, the learner gets equipped with hands-on skills on how to create various logic models such as theory of change, results framework, logical framework and M&E framework. Secondly, meal data collection. In this module, the participant will develop more knowledge and skills on data sources and data quality, quantitative data collection, qualitative data collection, mixed approach and data management. In the third module, which is meal data handling, the learner gets to develop hands-on skills on how to conduct quantitative data analysis, qualitative data analysis, data visualization and data interpretation. In the fourth module, which is using meal data information, the participant gets to develop more knowledge and skills on meal communication plan, meal learning plan, adaptive management and meal reporting. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Okay. So an anonymous attendee is asking, what is the criteria of collecting the child data in remote area? Okay, this was just an example because some of the projects are actually impacting or directly benefiting children. I gave an example of education projects or youth trainings, because remember, children is according to UNHCR, is anyone under 18 years. So regardless of where they are, whether it's in a remote area or in an urban area, if they're beneficiaries of the project, and if you have the go-ahead also from your from the organization to collect data from them and from the donor also, because sometimes this is very sensitive, you can go about to collect the data, and then you can select, again, the sampling now depends on their locality, the schools which have been reached, but you also have to choose as per who has consented to participate in this data collection. Okay, and then we have the last question, last two questions. We have Peter Gia is asking, in data pseudonymization is necessary for the participants to be aware in the form of a consent. Okay. No, so remember, when you're asking them for consent, you're also telling them that their information, their personal information, is not going to be publicized. So the assumption is already there that whether you're going to choose data pseudonymization or any other anonymity or confidentiality means, you're going to protect the participants. So you don't have to tell them that you're going to data pseudonymize their name, because remember, at this point when you're collecting the data, you don't even know if this information from this particular person is going to come out at the report stage. Because remember, a report, you have to conglomerate like a lot of data. If something is really outstanding, maybe you can put it as a quote, or if the person is a really key informant or someone who has brought in a very powerful point, maybe you can put it as a quote, or you can decide to put it as a case study. So at that point, you don't know whether you're going to use that measure of anonymity or confidentiality. It's only that you're supposed to just make sure that you've ascertained to them that they're not going to, their name is not going to appear in the report at any point. And the information you're only collecting is just to make sure that they're the right sample. And that's why we just needed to verify your name or your contact details, whatever information that they give you. And remember, they can also decide to give you a fake name and you do not know. So there's always that risk. But that's now a different story. I hope that's clear. And the last question, we can ask Abdi Fatah Ali is asking, how does culture affect data collection, and what are the important cultural issues to consider when collecting data? Okay, because even in this forum, we are from so many different cultures. The cultural norms are things like gender issues. For example, like some communities may be more conservative than others. So when you're collecting data, it's important to be respectful of this. You as the data collection person or enumerator needs to be conservative if they're conservative, so that there's that rapport even when you're starting to converse with them. Maybe, for example, they don't talk about some things openly. It could be things about, gender-based violence issues. Maybe they have some pseudonyms around this. And it's not that they don't talk about it, maybe it's just that they use different terminologies. It's important to understand this beforehand, so that even when you're communicating with them, they are more approachable. They can give you the information that you require when you're collecting data. I think the second part of the question was, what are the important cultural issues? Yes, so those are the important things. So it's very different. Each culture is different, but it's important to have that internal awareness and knowledge beforehand. And even things about like language, the language that they use. It's important if you can get maybe an interpreter or a person from that community to be the enumerator. It makes a big difference for them to also accept you and also accept to give you the information. I hope that's clear. Okay, I think Eric, then we can move on to the naive questions.
Thank you for that, Winnie. I think at this juncture, we can move to the session where we allow our participants to ask questions. And to do that, you can raise your hand up and I will get to you. And I will allow you to unmute your microphone so that you may ask any question to our participant, Winnie, or to HG as the organization. And I can see a few hands up currently. Ado, are you there with us? Ado Gabo, are you there with us? Kindly unmute your microphone. Ado, are you there with us? As we wait for Ado, Abdurrashid Noor, are you there with us?
Yeah, how are you?
I'm
I'm
very
not
fine.
commenting the Humanitarian Global. Nothing. It's enough.
Yes, Noor, you
Can you
may
hear me?
ask your questions. Yes, I can hear you.
Can you hear me?
Yes, I can hear you.
No, I have not questions. It's enough. Thank you. Well, pressure. Global Humanitarian Global Institute.
Thank you,
It's
Noor.
enough.
I can see a few hands up. Aliu Terry, are you there with us? Aliu Terry, you can unmute your microphone. Okay, as we wait for Aliu, Clicks Miller.
All right. Thank you, coordinator. Thank you, Winnie, for this great presentation. I have two smart questions. And the first question is this. If potential respondents are reluctant to give consent or the required information, is it legalized for us to introduce incentives in order to get this information? That's the first question.
Okay, I think you finished your first question. Let me answer that first. As an NGO, if you're working for an NGO, I'm going to assume, or any other organization that is supporting vulnerable, marginalized people, or people who need any form of help, it's not appropriate to give any form of incentive for you to get consent. Because remember, one of the main things that I was emphasizing is that the consent needs to be voluntary and willing. And remember, once you give that incentive, whether monetary or not, one, you have kind of changed the person's attitude towards the project. And there's this assumption that you will always give them something once you need any information from them, and that you would also always provide something, that whatever incentive that you've given. And then two, you've also kind of impacted the information that you're going to receive. It may not be completely authentic. It may be skewed, and the person may decide to give you actually very positive feedback, because now you've already kind of gotten what do you call it? Like you've bought their feedback, if that makes sense. Yeah, I think that's my answer to that.
Yes, thank you so much. It's very precise and concise. The last question is this. If after collecting information and at the point of publishing it, you receive calls probably from some respondents or community actors or other stakeholders indicating that you should withdraw responses from some certain communities or respondents, how should you manage information at that level? Thank you.
Okay, thanks, Miller, for your question. So first, maybe you need to understand also where they're coming from. What is the issue? It could be something to do with not necessarily the data collection that you've undertaken, but the project itself. So maybe they may feel that they were, I want to use the word marginalized, in that maybe they feel that not the right people received the aid that they were supposed to receive, or maybe they wanted more people to be included, and so they feel that those who give feedback may be biased in one way or another. Secondly, the thing is, you also need to make sure that you re-emphasize to them that, you know, in your reporting, there's no mention of any particular person by name or by any other identifiable way, or any community, because at the reporting stage, either you or whoever is going to be doing the reporting has to do some analysis before that. So it's not that you're going to just collect the information and then you say that this community says this, because it's every individual has to, has some different input when you're doing the data collection. So it's at that point, it's you need to be clear on what exactly the hesitancy is about. And then once you also understand that, you just need to explain to them that there is no, that it's not going to be, they're not going to be able to know who said what, even if they were from which community. And then again, even a further step from that is that you tell them that you're going to actually have a meeting with them and disseminate the findings of the report. Once you do that, you're becoming very transparent, and they can actually even have more trust in you, and they can be very open and willing to give you more information, especially when we are doing things like needs assessment, and you need to make sure that you're actually capturing the needs that they want, and they can also take up the projects to be their own because they feel very included in that. Is that helpful?
Very helpful. Thank you so much.
Okay, you're welcome.
Thank you for that, Klix Miller and Winnie. Jacob Garang, are you there with us? Jacob Garang, are you there with us? You may unmute your microphone.
Yes, hello, Eric.
Yeah, hello, Jacob.
Yes, good morning. It is still some minutes before midday.
Yes.
Hello.
Yes, Garang.
Yes. Yeah, how are you today?
I am doing okay.
Yeah, let me just go straight to my question.
Okay.
Yeah, thank you for giving me the chance. I had raised it earlier on in Q&A section, but it seemed like it did not reach you on time. So my question is pertaining to security of the participants, or let's say the enumerators, those who go to the field and collect the data, or rather who do the data collection activity. Assume you have gone into a kind of area where there is insecurity or there is some sort of fragile context, and you went and faced some threat, you've been told not to return by some members of the community. And then when you return back and report it to your organization or the team concerned, say M&E team, they insist that you return to the same location or field. So what can you do in such scenario? That's my first question.
That's well noted.
Thanks,
Yes,
Jacob, for your question. Yeah, so I understand these scenarios, and they happen especially in those volatile areas a lot. So I think one of the ways that you can mitigate this is, okay, firstly, even when you're planning for the M&E or any data collection, you already have, I talked about like a risk matrix, and one of the main risks that are there in this highly volatile areas is security, and we need to be very cognizant of that. And there are things which accelerate the security risks at different times. So you need to also plan ahead, and sometimes this can be you already know there are seasons of high insecurity. So when you know it's high insecurity, it's not safe already to send your enumerators, especially when you know that they're not people from that area. So one way is once you already plan and you feel that you still have to do the data collection, it's important as much as possible to get people who are from that local community, so that you decrease some things, such as if there's some pushback in terms of pushback from the community, in that they may not be willing to give information to an outsider. You've already at least come through that barrier. The other thing is to also now use this remote data monitoring, data collection methods. So you can, if you're able to actually contact beneficiaries directly via phone, or if you're not completely able to get the beneficiaries, you can decide to talk to the other stakeholders, so such as maybe NGOs who are operating in the area. You can talk to, anyone who's you feel that is accessible, that you don't need to go to the area physically. And you can actually use that in your reporting. If you're able to, get some extension of time, you can go now when the climate is a little bit less hostile. But it's important to also be very transparent in your reporting and say what the situation was and what you envision, how long you envision maybe this to go on for. And then now from there, you can now have your mitigating issues to support. I hope that's helpful.
Thank you so much. It is clear, and I think this is something we've been experiencing. I myself also fell in such conditions some other time when I was in data collection activity. So as I said earlier on, I was having two questions. That one is already answered, and the other last one is concerning the
Okay, as we wait for Garan to ask the second question, we can be hearing from Noah. Noah, are you there with us?
Yes.
Yes, hello, Noah, and you may proceed to ask your question.
Thank you for the opportunity. My question is only one. I would like Winnie to answer it for me at least, but I look like she talked of it, but I'm going to take it in another way also. I would like Winnie to talk about this one for me. What are the potential norms when carrying data collection in jungle areas? So when we look at it like how you explained earlier on, when we are going to those like enumerators, when they're going to the jungles areas, there might be other difficulties that they're facing, like in that side of the cultural norms from people on the ground. So I would like you to elaborate more on that. Thanks.
Okay, thanks, Noah, for your question. I'm not sure if I understand what you mean by jungle areas, but if we're talking about just cultural norms in general, as I explained, every context is different, and we need to understand first the concept in the context before we are collecting the data. So if the project has already started, you already have some knowledge of the people in the area, you already have you understand, you need to sit also first with the project officers to understand during the implementation, for example, what kind of pushback that they had. Because even in my experience, even when you're starting a project, sometimes it's it takes longer than usual because of those pushbacks and maybe even understanding the environment and the society. So it's important to first understand where how the community is, understand what is acceptable and what is not acceptable, because this is going to help you even when you're collecting the data. So when you're asking the question, how you're going to ask even the participants that you're going to choose, how you engage with them, whether there are things which are frowned upon by different genders, different communities. So it's I can't speak to one issue or another, but it's very general. So it's just important for you to absorb yourself in that community, for you to be able to get the most out of it. So even read other reports from other projects which have done some projects in that same community. Maybe read on the issues that they have, the challenges that they had, maybe any gaps and recommendations that they had. And this can also help you in your planning and when you're conducting the data, the data collection. Yeah, I hope that's helpful.
Amazing. Thanks for that.
You're welcome.
Thank you, Noah. I can see Ohoro Leo.
Yes, thank you.
Leo. Yeah,
Yes, yes.
you may proceed to ask your question.
Yeah, my questions is about from the additional ethical measures. The question is like this. There was a point that Winnie put about adhering to the local customs, cultures, and norms. My question is, in a scenario where you find a community that's not allowing women to share information, because we have this kind of communities here with us. So when you find this kind of a community, so as a data collector, what are we supposed to do here? Thank you.
Thanks, Leo, for your question. And yes, this is an issue that comes out predominantly in some patriarchal societies. So the first is, as I mentioned, this should not be a new occurrence that you're finding out when you're collecting the data, especially if the project has already started and is ongoing. So that means that the project officers or whoever is implementing, even if it's you have a local implementing partner, they are already aware of this and they faced these challenges when they started the implementation. So as I mentioned to Noah, the first thing that you should do is also sit down with the project person and understand what the context challenges were. So you can note that down. So to your specific issue, when they don't allow women, you need to find out, is it women of a certain age? Is it all women? Are there some women who may not be centrally located, like maybe you can find them like in other like the periphery of the community geographically, and maybe you can be able to get some information from them because now there's no one nearby who can see that they are giving this information. So it's about being innovative about it. So maybe they can give you information if you can keep the women together in a group. So you can decide to go with a focus group discussion as a way of now getting the information, whereby now the women are just sitting together, they're discussing. And then also what helps sometimes is also to have a female enumerator, so that it also looks like it's just a conversation that they're having, that you're having with the participants. And now from there, you can be able to get that rapport that you need. And then now when you get also the findings, I still insist on disseminating the findings to the community. It's important to sit down with like the authority figures who are like the elders, who may have like some reservations about women talking because of one thing or another. But once you tell them that these women, they're able to, you can say like the findings of the report find this and this, maybe not necessarily saying that the women said this. And then the elders can also be a little bit more flexible, hopefully with time, or open-ended, to now make sure that this also changes. Because at the end of the day, you can do all the project implementation that you want, but if there's no change, there's no impact. I hope that's helpful, Leo.
Yeah, thanks.
Okay, great.
Thank you for that, Leo and Winnie. And due to time, ladies and gentlemen, allow me to invite Anthony from Humanitarian Global.
So thank you, Eric, and also to Winnie for the wonderful session. I can see the time is not on our side, and we've got very many questions, and they keep on coming. So as we said, it might be impossible to tackle everything here. And that's why I'm encouraging you to ensure that you can enroll in the Humanitarian Global community, so that once you head over to that page, you're going to be in a position to post your question. So what I'm sharing on my screen, that is what you're supposed to be seeing after you click the link that we've been sharing with you. So you're going to be required to sign up. It's a very easy process, and I can even see some of us have started posting questions, like Joseph, you had posted your question, and then we've been able to give a response to that. So all the questions that you have concerning the session, we encourage you log in and then try to locate these topic. So we had created a topic for the webinar for today. So come click on that topic and then you start replying with your questions. So once we get your replies in form of the questions, we're going to respond to them. So it's an easy process. We've been sharing the link with you, and also my colleagues, they're trying to share the link again. So check on the chat section for the humanitarian global community so that you can join, and then you can post your questions there. We promise to answer all your questions. So head over to the community, post the questions that you have in regard to this session. And then in case of also any other inquiry, we have left you with the details there on the chat section on how you can reach out to our team. So we would like to extend our gratitude for joining our session today. We believe it has been helpful, and thank you so much for attending. Thank you so much for inviting your colleagues and friends to attend to the same session. So as we promised, we also want to ensure that within the course of tomorrow, you're going to get the recorded version of the class on our YouTube channel. And also you're going to have the slides being sent to your email. So as we said previously, you can go to our website, and this is where you have access to all of these platforms, that is starting with the YouTube channel. So if you click on the YouTube link, you're going to be redirected to the channel, and this is where you can even see our previous sessions. So we have done very many sessions, and you can have an access to all of our sessions there. So we not only cover the meal side of it, or maybe aspect when it comes to humanitarian and development work, but we also do train in other areas as water sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, human nutrition and dietetics, maternal, infant and young child nutrition, procurement and supply chain management, among very many other areas. So make sure that you can go to our YouTube channel, subscribe so that you can be among the first people to always get a notification whenever we have these upcoming sessions or maybe recorded classes being uploaded there. So we would even, if this is your first time, we would like to encourage you to go and review all the way from the first episode that we had in MIL, so that you can get the flow, because these classes have been building up on each other in terms of what we discussed today does prepare well for the upcoming session. So just rewind, go and rewatch the first episode. We have the second episode, and we are liking your positive feedback. You can see it has a very good audience. It has been able to reach out to very many participants. Also continue sharing the link with your friends, your colleagues, within your networks, in your countries, in the meal forums that you are part of, the meal groups, the WhatsApp groups that you are part of, so that they can also get to enjoy. And also when it comes to certification, further training, head over to the website again, locate the course of interest that you'd like to undertake with us. And for example, you might be interested in undertaking a certificate in meal course. So that would mean that you can easily go to the platform and just try to locate that course that you'd like to study with us. So once you click on the course, you can access all the details. So the tuition fee, the course outline, and this is where you see what is going to be covered in your course. And for you to apply, you just have to click on the apply button. So it's very easy for you to register for these courses online. And then there is a form that is going to pop up here. And then you just have to fill that form, and then you can be able to submit your details. So once you've done that, our team, they're going to reach out to you so that they can guide you further on the enrollment process. So there's quite a lot that we're going to keep on discussing, and I encourage you go to the student forum. So again, on the website, you can see there's a link for Humanitarian Global Community. Make sure that you can click on that link. It's going to redirect you here. Ensure that if this is your first time, we have very many forums. You can head over to the meal forum, start by introduction. You can introduce yourself. Like Jane has done here, and Liban has also done the same. So introduce yourself. You just have to reply to that topic. And then for the questions, make sure that you can head over to the topic for today, and then reply with your questions, and then we're going to answer them. So thank you so much, and I wish you the very best from Humanitarian Global. Let's continue learning and practicing what you've gained from this session, and spread a word about Humanitarian Global to your colleagues.
Monitoring and evaluation have been considered to be an essential component of project management. As project management continues to evolve, there is need to incorporate stakeholder participation, information sharing, learning, accountability and organizational transparency. To address the inadequacies of the previous M&E framework, MEAL course has been developed to incorporate these accountability and learning aspects. Undertaking a postgraduate diploma in MEAL prepared by Humanitarian Global will help the learner develop an in-depth knowledge and understanding of evaluation designs. In this module, you will get to learn more about experimental design, quasi-experimental design, non-experimental designs and comparison matrix. Secondly, evaluation approaches. The second module aims at covering various evaluation approaches such as feminist evaluation, transformative evaluation, real-world evaluation and realist evaluation, equity-focused evaluation and developmental approach to evaluation. Thirdly, preparing for an evaluation. The third module details all the steps involved in preparation for an evaluation by helping the learner to understand the initial steps, construction of theory of change, development of results chain and specification of questions. Also, you learn more about impact evaluation. In this fourth module, get to learn more about evidence-based policymaking, what impact evaluation is, prospective against retrospective impact evaluation and efficacy studies and effectiveness studies, deciding whether to carry out an impact evaluation. In addition, you will learn about causal inference and counterfactuals. In this module, the learner will get to study more about causal inference, the counterfactual, estimating the counterfactual, and 2 counterfeit estimates of the counterfactual. Our sixth module is instrumental variable. This module offers more understanding on how to evaluate programs when there is no compliance, types of impact estimates, imperfect compliance and the randomized promotion as an instrumental variable. The seventh module covers the difference in differences. This module will focus on teaching the participant on how to evaluate a program when the rule of assignment is less clear, the difference in difference method and how helpful it is as well as understanding its limitations. Lastly, you learn about matching. In this final module, you will get to learn more about constructing an artificial comparison group, propensity score matching, combining matching with other methods, and limitations of the matching method. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.